Pain is one of the most difficult things we ever deal with. And we sort of know, all of us, that almost everybody can be brought to pieces by pain. Especially the chronic pain is a mind-destructive experience. So that's where somebody like Dr. Shannon is uniquely positioned, because that humility is in Dr. Shannon. And you need humility to be able to help people.
Way back in high school, I was selected to be a part of a summer program called MS Squared. Stood for Math and Science for Minority Students, and it was held out of Phillips Andover Academy in Andover, Massachusetts. We had some teaching assistants in our ecology course, and they told us, you guys can go to Ivy League schools if you want. And coming from inner city Chicago, I never even imagined that that was something that I could aspire to. But they put this idea in our heads, and they put that fire in our belly.
The drive is there as well, because as a doctor and as an anesthesiologist, he knows how important it is to be pragmatic with your patients. You start with humility. You don't start with flashing out your textbook knowledge or some degree or other, because that's useless at that point. What's useful for them is that you understand from a different angle, but on the same level, at that level of that suffering. That's exactly the kind of doctor you want to be taking care of your pain.
After I listen to your story, after I examine you, I come up with a plan that is tailored for your problem. And it's different every time. It's great when everything follows an algorithm, but life is not that way. That's just the truth of life. Everything needs to be tailored specifically. Pain is not always going to be just treated with medications and modalities. Sometimes it's a mindset. There is an evolution in the way that you practice and treat patients. It really is a balancing act. So we don't rely totally on medications. We don't rely totally on nerve blocks. We don't rely totally on cognitive, behavioral, or psychological therapies. It's a balancing act of all of those things. I know I'm in a pain clinic and we want to look at your pain and decrease your pain, and we concentrate on numbers. Your pain is a 5 out of 10 in severity. We use that 10-point scale, but what is really important for me to know is how your function is being impacted and how your function can actually ultimately be improved. The very cool thing about the university is that we have a collaborative relationship with some of our other physicians, so that if we need to, we have those practitioners at the ready. I always talk to the residents, they give me purpose. Being able to teach them, to mentor them, it actually gives me purpose and makes me feel like I fit someplace. To let me see some of the possibilities, the way my life could be, it's a full circle.
All of us, come to this place where you have the opportunity to become the best version of yourself. You don't know what you can accomplish unless you are put in front of challenges in the magnetic field of good people, that drive you in a certain way. And I can tell you that there is no better satisfaction in my professional life than seeing people in my lab and in my clinic accomplishing something that's just phenomenal. They're just so much above what they ever thought that they can do.